Hello everyone! We all know metformin is a first-line and widely prescribed medication for managing type 2 diabetes. It's affordable, effective, and generally safe. But did you know that in certain critical conditions, the same metformin can become dangerous? Today, let's meet Mr. Ramesh, a 69-year-old gentleman whose story shows how the benefit-risk balance of a drug like metformin can change drastically depending on the situation. Let's dive in. Scenario 1. Let's rewind to before April 2025. Mr. Ramesh had been diagnosed with type 2 diabetes mellitus 6 years ago. He was taking metformin 500 milligrams twice daily. He lived independently, was physically active, and had no kidney or liver problems. In fact, his diabetes was well controlled and he had no hospital admissions in the past year. Benefits: excellent glycemic control, no risk of low blood sugar, hypoglycemia, inexpensive and generally well tolerated, no contraindications based on his baseline health. Risks: very minimal. Routine monitoring of kidney and liver function is advised, but nothing alarming. Benefit-risk conclusion. In this setting, the benefits clearly outweigh the risks. Metformin was safe and effective for Mr. Ramesh. Scenario 2. Mr. Ramesh is rushed to the emergency room with fever, confusion, low blood pressure, and rapid breathing. He is diagnosed with septic shock due to urosepsis and admitted to the ICU. Let's look at his lab results. eGFR 28 milliliters per minute per 1.73 square meters indicates acute kidney injury AKI. AST 178, ALT 152, elevated liver enzymes. Lactate 4.6 millimoles per liter, pH 7.18, metabolic acidosis. Despite his critical illness, Mr. Ramesh had continued taking metformin at home until the ICU admission. Now here's the important question. Is the benefit-risk balance still favorable for metformin in this condition? Answer: no. Risks: sepsis causes poor tissue oxygenation, which increases lactic acid production. Kidney dysfunction, AKI, reduces metformin clearance from the body. Liver dysfunction impairs lactate metabolism. All these factors greatly increase the risk of metformin-associated lactic acidosis, or MALA, a rare but life-threatening complication. Mr. Ramesh's elevated lactate level and metabolic acidosis are red flags confirming this risk. Benefit-risk conclusion. In this acute and critical setting, the risks far outweigh the benefits. Continuing metformin is dangerous and contraindicated. Actions taken. The care team acted quickly. 1. Metformin was immediately stopped. 2. Ramesh was shifted to an insulin infusion for blood sugar control. 3. Was started to correct the metabolic acidosis. 4. Continuous monitoring of his renal function, lactate levels, and acid-base balance was done. 5. A hospital safety alert was issued, advising that metformin should be paused in all ICU patients until medically safe to resume. Key takeaway. Mr. Ramesh's story reminds us of a vital principle in medicine. Medication safety is dynamic. It depends on the patient's current condition, not just their history. While metformin is a fantastic option for stable outpatients, it becomes potentially fatal in patients with sepsis, AKI, or liver dysfunction. Healthcare providers must pause and reassess the safety of medications like metformin during acute illness, especially in the ICU setting. So the next time you see a diabetic patient in critical care, think twice before continuing metformin. Always weigh the current risks against the usual benefits. Stay alert, stay informed, and most importantly, stay safe for yourself and for your patients.